Ayurveda and Panchakarma. Panchakarma and Ayurveda. These two terms are very commonly mixed together and used, although both are entirely different. Now, when we come into the matter of Ayurvedic eye treatment, what is the role of Panchakarma? Let us try to understand.
Ayurveda is equal to Panchakarma. That is a wrong statement. But Panchakarma comes under Ayurveda. That is the correct statement. Because Panchakarma is a deep-rooted treatment procedures to treat the pathological changes of the diseases and also to maintain the health of a healthy person. So it is a particular system that maintains the health of the person, whether in diseased condition or in undiseased condition. Now coming to eye treatment. All the eye treatments are not in the same intensity or the same level. There we can generally say that there are three groups of diseases. One is external, maybe due to trauma or a wound or any other insect bite, something like that. Anything where the cause is external. That type of disease are to be treated in a particular way. Then external application, that way direct ophthalmic applications are more important in such cases. And if it is more serious, oral medicines also will be necessary. Then the second group is independent eye diseases, which is originated from inside. So many diseases are like that, starting from glaucoma or degenerative conditions and such diseases, which are independent ophthalmic pathological conditions. There, a deep level ophthalmic treatment is necessary. That means we have to select only these drugs which acts on the ophthalmic tissues and control its progress. Like that, the treatment principles are very specific. Then there is another third group which seems to be associated with some other systemic diseases. It may be sometimes even a ophthalmic symptom of a general disease. Sometimes it may be an ophthalmic complication of a systemic disease. This group is very important nowadays. One disease that everybody knows, diabetic retinopathy and hypertensive retinopathy and ophthalmic complication of these thyroid functions and infections from the general skin lesions. Like that, that group is very high, number is very high. About 50% of the ophthalmic conditions are supposed to be connected with other systemic diseases as a symptom or as a complication or as a sequel. Like that it varies. So in such situations or in such a type of ophthalmic diseases, we have to consider the whole body, at least that systemic condition or disease which is existing in that body. Without touching that area, a correct treatment is for the eye disease only is not possible. For a diabetic patient, if there is diabetic retinopathy, we have to consider the diabetes also. I have seen that in many cases, even though we are not giving any medicine for diabetes and only concentrating on the ophthalmic condition, then itself the diabetic level is coming down because there is a link between. That is the basic theory behind that. In such conditions, the whole body is to be considered. Such a treatment also has to be charted out. Here comes the importance of Panchakarmas. Panchakarma means that touches the whole body. Actually, it is there are all these things are said to be Shodhana therapy in Panchakarma. That means to eliminate or to drain out the unwanted things first step as a first step of treatment. whether it is accumulations or blocks or deposits, whatever it may be, whatever unwanted or unnecessary in our body should be drained out or should be eliminated through the natural routes. That is very important. Not syringing out or not making an excision and clean it, not like that. Through the natural routes. That means either through the nasal route, or by vomiting through the mouth, or through the urine, or through the feces motion, or by perspiration, by sweating. Like that, there are some external orifices to get it eliminated. And these things, this cleansing of our body is by the natural routes, through the natural routes. That is achieved by Panchakarma therapy. So, when we touch a systemic disease and an associated eye disease, we have to do this type of a basic treatment also. That will be highly beneficial. Otherwise, what will happen? We can manage the eye problem, but it will recur again because the basic problem is still there. As long as diabetes is there, there is a tendency of or possibility of complication as retinopathy. So we have to consider both the diseases in equal importance. In such a situation, the role of Panchakarma therapy or cleansing therapy or maintaining the health, that type of Panchakarmas, everything is very, very important. That also should be considered.